Hi everyone, my name is Ricciardi and I'm currently a third year at Cleveland State University in the Occupational Therapy Doctoral Program. I'm just going to spend a few minutes today talking a little bit about my capstone experience and just describe and explain why I made the deliverables I did and what I made. So for my capstone experience, the title of my overall project is the development of comprehensive educational self-management materials, specifically for thumb arthritis, with an emphasis on improving occupational performance through applying health literacy principles. So my capstone aims to highlight the critical role of health literacy in the patient education materials for the population of hand therapy to overall achieve the promotion of self-management of their symptoms, understanding of their diagnosis, and just overall enhance their quality of life. So for my 14-week experience, I worked in conjunction with the Cleveland Clinic, and I was placed at Akron General Health and Wellness Rehabilitation Center in Greene. I also traveled to Talmadge and Bath on occasion to work alongside of licensed therapists and certified hand therapists, specifically treating patients with upper extremity and hand-related diagnoses and conditions. I spent the majority of my experience on site with these therapists, getting to provide direct hands-on patient care. And that included carrying out interventions, doing evaluations, documentation, completing some custom orthotic fabrication, and just getting to know more about the population, working alongside of the surgeons and with the rehab team, and just understanding the role that OTs serve in hand therapy and what it looks like to be a certified hand therapist with an occupational therapy background. So my experience, there was overall goals of additional training and learning, as well as the creation of these health literate patient education handouts with a focus on CMC arthritis. We came up with this collaboratively in a conversation I had with my site mentors as well as the rehab manager, where they all kind of talked about how important CMC arthritis is and how prevalent it is in the population, and they see it very often with the patients that they see. And arthritis can be a very debilitating condition, and this overall impacts their quality of life, their ability to participate in ADLs, work-related tasks. And there are so many ways that we, as occupational therapists or hand therapists, can educate patients on conservative approaches to prevent and delay surgery as long as possible. So I was kind of tasked with diving into the literature and understanding kind of best practice, the topics and resources and tools used for conservative management, and then developing health literate education handouts to provide to patients. So I was given some resources that the Cleveland Clinic already uses, such as exercises, soft tissue, mobility, some stretching, and I also added in what is on my poster, some joint protection principle handouts, and I took all of the handouts that they currently or previously were providing to patients, and I used readability measures in this health literacy checklist to make sure that everything was clear, concise, had visual aids, was very engaging and easily understandable for patients to promote optimal compliance and patient outcomes with the conservative management of this condition. I also found that on my experience that a lot of the patients in the Akron area come from diverse backgrounds. So all of my patient education materials were then translated into some of the most common languages that they use, such as Nepali, Spanish, and Arabic. But overall, this capstone experience kind of utilized the occupational adaptation model by focusing on activity modifications and compensatory strategies or techniques that patients could use, and just an emphasis on the self-management and understanding of their condition and how they themselves can be educated and provide and participate in daily life. Overall, it was a wonderful experience. I feel that one of the challenges that I endured was that I focused just specifically on this carpal metacarpal CMC arthritis. However, we saw so many different conditions in hand therapy, and I do think that the therapist there, as well as all therapists, can always keep in mind how important health literacy is, so in the future they can kind of revamp their handouts and just ensure that patient understanding is always there and how important it really is to reach those desired outcomes. Thank you.